Our goal is to share our concerns. We are not a rabble-rousing group. If we have a town hall, our goal is to let him speak, not to shout him down. We want him to hear us. We want him to act on what he hears. We want to get reassurance from him that he understands our concerns.
Absolutely.
So one of the things that we are going to ask of him is that you, as his community representative, let us know when he is here, and let him know that we would like him to hold a town hall meeting. We are a much larger group than this, and our group is very respectful, and if any other groups join us, they will be given the same instructions, that one person speaks at a time, and we listen when the congressman is responding. But it's important to us not just for him to hear what we say, we want to know what he's thinking.
Right. And he will do that.
And it's unfair for us to find out what he's thinking when he issues a vote. Because I can tell you that will make a lot of his constituents unhappy.
I don't think we're asking that he has to tell us how he would vote on something that isn't quite finished, but just having 3 principles doesn't necessarily tell us how he would apply those principles to what's being proposed. There's main issues in that 100 pages, other than what says I'm referring to the Obamacare bill, that he could say, I would in general agree with this. I do not like mandates. He's already saying some things. And I think we have a right to know before he goes in there and votes for something, because once he's voted on it, it's kind of too late.
Okay, well, we're here about the health care bill specifically.
Sorry, we just turned down. It was a little chilly now. It's getting
Okay. I can talk louder, but you couldn't perceive it as yelling. That would be important. Okay, because we're concerned about the people in the villages, which has a large percentage of people older than 60. And under the new legislation that's up for review, some of those people we think will be put at a more significant financial disadvantage under the new law, if it passes, than the existing Affordable Care Act. So the American Health Care Act, we think, increases the cost potentially for the seniors in the villages who are not yet Medicare eligible.
I'm one of them.
I think we probably have several here. And so I have some statistics, but I have to look down to read those because I don't want to get them wrong. A person with an income of $40,000, the tax credit that they're talking about giving in the American Health Care Act will be between 26 and 36% less than the subsidy they're currently getting under the Affordable Care Act. So that will be an increase cost to them. With income of $50,000, it will go down. It'll go to 10 to 23% less than the subsidy. So people have to pick up that cost somewhere. Also, under the newer law, I'm going to get them confused. The American Health Care Act, 60-year-olds can be charged 5 times more for premiums than a younger person, as compared to 3 times more under the current existing legislation. So these are concerns for people in the villages, many of whom retire here thinking that they have affordable health care. That goes away. Then what do they do until they're Medicare eligible? That's a problem. And the other concern we have, without involving everybody and without having a mandate, people will opt out because it's more economically feasible for them to do that, which is part of the problem, as you know, with the Affordable Health Care Act, but it is a continued problem with the new plan. The choices people will get with even the younger people is not really enough to buy reasonable health care policies, because it's $2,000 over the whole year. There are very few plans in America today, in any state, where that would cover your health care insurance for the year. So this will put more people at risk for being uninsured. And then the pre-existing conditions, they can't be denied insurance, but they can, in the new plan, the American Health Care Act, they can be put into risk pools. Because some of what's happening with the American Health is that they're moving this back to the states to set up whatever insurance they think is possible. So, and people can choose. That's the thing. We'll give you this tax credit to pay for it or whatever. So when you're in a higher risk pool, you know that your insurance rates will automatically be higher. So anything that does that to people is a big concern, especially people with incomes 40, 50,000. I mean, it sounds like it should be a lot of money, but after taxes and costs, it's really not a lot extra. And in the end, tax credits actually are better for the wealthy than for the middle class and the poor.
Star on that.
Right. So this plan makes it easier for a wealthy person who can put resources aside to cover the high deductible plans at the lower tier and pay less than, say, an average person in this country, this county, this city doesn't have the resources to put aside $7,500 for their deductible, $20,000 for out-of-pocket maximums, and pay that. It's just not reasonable. Under the GOP plan that's currently being talked about, the Medicaid expansion program will be frozen in January of 2020. And Florida is not currently a part of the Medicaid expansion program. Governor Scott didn't want to do that, which effectively denies affordable insurance to low-income people in this state currently. And his term is up, and a new governor, when they come in, really should be given an opportunity to evaluate the need for expanding Medicaid when they get here, and not just be faced with a fait accompli. So we'd like them to vote no on this plan until Florida has a chance to evaluate for itself what they would like to do. And then the number of people who will lose insurance coverage under the American Healthcare Act is about somewhere up to 15 million people. That's a lot of people. And we are very concerned about all of them, regardless of state. So we would ask Mr. Webster to please vote no on this plan and really be part of a process that creates a reasonable health care act for Americans, all Americans, young Americans, middle-aged Americans, working Americans, old Americans, retired people, employed people, unemployed people for whatever reason, disabled people, all of the people in America.
Veterans.
Veterans, all of us, to have a plan that will take us comfortably through for our health care so that we don't have to file for bankruptcy.
Children.
Young people, babies. So the current plan is really not the kind of plan that talks about providing that kind of comprehensive coverage. It really talks about shifting costs. So we would like to see a more comprehensive health care plan